I am Dr.Raghava Dutt, Director and Chief of Spine Surgery at Uday Omni Hospital, and I've been practicing spine surgery for the last 30 years in Hyderabad. Everybody is worried when a doctor says you require surgery for your spine problem. As we all know, and as you are probably aware, spine surgeries are very complicated, requires a lot of training for the surgeon to perform these surgeries, and you need immense experience to do these surgeries. When do we do these surgeries? Most times, unlike what people think, a lot of conditions such as a slip disc which causes pain in the lower back, or a disc in the neck that causes pain in the neck and pain going along the both upper limbs or arms, these conditions are sometimes degenerative conditions, what we call spondylosis, neck spondylosis. We call it as cervical spondylosis, lumbar spondylosis. All these conditions, about 90% of them can be treated without surgeries. So most people with common degenerative conditions should not undergo surgeries, because by changing their lifestyles, by taking care of their weight, regular exercise programs, leading a healthy physical life, exercising. For example, every one of us should exercise at least for an hour and a half every day, and that should be very vigorous exercise. Some small walk in the garden is not exercise. That doesn't help our spine. So swimming, yoga, sports, this is all what young men or men and women at any age should do. And we're also seeing that because of computers, be it in banks, be it in government offices or in the IT sector or businessmen, everybody is sitting for hours and on. And with the recent pandemic, people were working from home with Zoom calls and meetings. So this constant sitting affects your neck and also your lower back. So also the excessive use of these gadgets. We see this happening all the time with our modern cell phones, smartphones, and all these iPads. And unfortunately, these being introduced in the schools as modern technology for children, which we all know will virtually damage not only their necks but also their lower backs. So we need to be careful of all these gadgets. We need them, yes, for sure, but we should use them in a way that they don't cause damage to our entire spine. So there are other conditions also. For example, infections like TB is rampant in our country. Lot of industrial accidents, motor vehicle accidents, falls from trees, toddy tappers who climb trees and fall in Telangana and most of South India. So all these people are all unfortunate victims of fractures to their spine, and then sometimes they get paralyzed. Likewise, as we are all aware again, there are lots of increased incidence of cancers being diagnosed, and there's a huge cancer burden in India today. So a lot of these cancers, almost all cancers, spread to spine and cause a lot of pain and suffering to human beings. And so much, again, a lot of rheumatological conditions like rheumatoid arthritis, ankylosing spondylitis. These are various conditions that affect our spine and cause severe pain. So when a doctor who tries his best to treat these without operations, when that doesn't happen, that means the patient does not get enough benefit from non-operative measures, then we do surgeries. Now, once we say surgery, there's a tremendous fear amongst patients, because spine surgery is associated with doubts in the minds of patients like, will I get paralyzed? I believe people tell us that I believe once you get operated on the spine, it's never the same, and that we need months of bed rest, and that we can't get back to our professions. These are some of the doubts that people have, patients have, and this fear of spine surgery makes a lot of people not to go for surgeries. Yes, unnecessary surgeries should not be done, and if you are in doubt, you must take a second opinion from another spine surgeon. Do not hesitate to do that. Once the doctor, if you're convinced about surgery, do not be too worried. Today, all the associations, including our Association of Spine Surgeons of India, which I was heading a few years ago, we are educating patients about safe spine surgery. So today our associations are in a massive program of teaching and training youngsters and in various subspecialties of spine. For example, deformities of spine, which is a very high-end spine surgery. These hunchbacks or scoliosis, what we call, correcting these deformities to, as I said before, operating with endoscopes, cameras, use of microscopes. All this modern technology has made spine surgery very safe. So you don't need to worry about subjecting yourself for spine surgery if you are in the hands of a good and well experienced spine surgeon. So also you must have heard of neuromonitoring. This is something what is like a ECG that you must have seen when you go to hospitals. Your family members or friends will have ECG in the ICUs. So this will tell us about the heart function. The same way most of our spine surgeons in India as well, we use these spinal cord monitors. That means when the child or adult is getting operated, you are connected to a monitor, and if something is happening that an adverse event or a complication, we can see, for example, if there's a damage to the nerve or an impending damage to the nerve, or spinal cord, we can see it on the monitors and we can immediately avert those complications. We also have today a CT imaging of the screws that we put in. So these machines, we can take them inside the operating theaters and then check the correct position of screws, along with modern navigation systems, where as we are putting screws in the spine, we know exactly where the screw is going, how much depth it should go, what should be the diameter of the screw, what is the length of the screw, what is the angle with which we should introduce the screws. So tremendous technology is coming in and is already available in Hyderabad in India. So spine surgery, when required, don't be too afraid. With modern technology, you'll get good results. Even artificial intelligence is coming into spine, and in a couple of years, this will take over a lot of spine surgeries. I'm wishing you good spine health. Keep fit, keep healthy, have positive attitude, exercise, and stay fit.